Well, welcome back to Morning Break. A new report released this summer suggests that suicide is now the leading cause of death for young adults in Georgia, with more than 60% of those deaths occurring in the 20 to 24-year-old age group. Well, Cherie McKenzie of the Georgia Apex program, Vera Salzberg of the Mediation Center of the Coastal Empire are here this morning with information on how you can identify if a young loved one is in crisis and how to help him or her get through it. Good morning, how are you?
Good morning.
Thank you for being here and putting focus on such a very important issue. We know Mental Health Week is next week, and then World Mental Health Day is next Friday. Always a good time, though, to get this information out.
Yes, exactly. Thank you, Tim, for having us. And we're here to encourage everyone to seek out help if you need it, to share resources, and we're also to help destigmatize mental health.
And the APEX program is doing that in a lot of schools locally, kind of putting the schools in touch with some agencies out in our town that can help.
Yes, absolutely. The APEX program is in 17 schools, and they are in Chatham, Effingham, and McIntosh counties. And if your child would like mental health services provided in your school, whether that be therapy or med management or both, children can reach out to their school counselors, or parents can reach out to their school counselors to get that help provided to the children within the schools.
And it's a time now where young people really face a lot more stress and anxiety, a lot of that because of social media, I'm guessing.
Absolutely.
Oh yes, of course. Social media, also a lot of factors that contribute to anxiety could be family-related factors, even climate-related factors. In Savannah, floods and tornadoes could be contributing to somebody's anxiety. So a lot of different external and internal contributing factors.
All right. And Apex, who do you work closely with?
Oh, we work closely with the schools, of course, and we are a part of Gateway.
Right.
Yes, so Gateway has 145 or so mental health programs, and we are one of those programs that are provided by Gateway.
Right. And I know that the child can go to a counselor, but is there a mechanism in the school where if a teacher or member of faculty recognizes a student might be struggling a little bit, that they can suggest some counseling?
Absolutely. They can go directly to their counselors and let them know that the child needs more help than what the school counselor can offer. They can also fill out the referral forms themselves if they would like.
And then, of course, we've seen great success with the peer mediation program that the Mediation Center has put in our schools.
Yes, exactly. The Mediation Center provides services in our school district to support youth and children with learning the skills and education how to mediate conflict. We also provide training to students and adults in suicide prevention and resiliency building. Just this last week, we supported multiple schools and elementary school children as well as middle school children. We also provide training and education to our local university systems and youth and young adults at Savannah State University and Georgia Southern University. So our approach to building resources and reaching out to individuals in our community is truly a public health approach. We are trying to not just focus on one group, but really reach out to multiple individuals, multiple organizations and groups.
Folks at home might notice some signs of anxiety too. Well, what might some of those signs be, and then what can parents or guardians do to help their child through it?
Yes, absolutely. In children, any sudden change that you notice, they don't want to hang out with their friends anymore, they no longer want to participate in their extracurricular activities, or they're suddenly staying in their room a lot, we definitely want to reach out to a mental health professional and ask for what they can do for their child. And I suggest not waiting. Do it as soon as possible. As soon as you notice a shift in your child, get them help ASAP.
Right. And Vera, I know every time the Mediation Center is here, you encourage folks to reach out in any type of anxiety or stress situation.
Absolutely, and something that I would love to promote today is the 988 crisis line number. So if you are in crisis, which we look at crisis as something that's self-identifying. If you think you're in crisis, then you're probably in crisis. So you can call, text, or chat 988. It's free, 24/7, and confidential service nationally.
Thank you both so much for being here.
Yes.
And I know next week this will get a little bit more attention during National Mental Health Week, and then also, of course, World Mental Health Day on Friday.
Yes.
Thanks again.
Absolutely.
Appreciate it.
Thank you, Tim, for
All
having
right.
us.
Well, it is really starting to feel like fall out there, in the mornings at least. When we come back, we're going to check in with meteorologist Andrew Gorton to see if this fine weather will continue all the way through the day.